The widespread presence of ultra-processed foods in the U.S. food supply, which now makes up a staggering 70% of available food products, presents a significant and growing concern for public health. Despite their convenience and widespread appeal, these foods have been linked to a range of serious health conditions, including obesity, diabetes, cardiovascular disease, cancer, depression, cognitive decline, and even early death. The growing dominance of ultra-processed foods signals a troubling trend, as these products, designed for hyperpalatability and mass consumption, contribute to health problems that are not only widespread but potentially irreversible. Ultra-processed foods, defined by their reliance on additives, flavor enhancers, and industrial manufacturing processes, represent a far cry from whole, natural foods. They often contain combinations of fat, sugar, sodium, and starches that are not typically found together in nature, and this engineered combination results in products that are hyperpalatable, foods that stimulate our brain's reward centers in ways that lead to overeating. For instance, the presence of sodium in these foods, when combined with fat or starch, activates the opioid system in the brain, making these products exceptionally hard to resist. This creates a cycle where individuals consume more than they intend to, fueling further overeating and addiction to the taste and texture of these foods. The consequences of such consumption are severe. Studies have shown that individuals who eat ultra-processed foods consume significantly more calories, often up to 500 extra calories a day compared to those eating minimally processed foods. This overconsumption can lead to weight gain, which is a well-established risk factor for obesity-related diseases, such as type 2 diabetes and heart disease. Additionally, the energy-dense nature of ultra-processed foods, which are low in fiber and water, encourages overeating, as they provide fewer satiety-promoting nutrients that would typically signal to the brain that the body has had enough to eat. This physiological response exacerbates the problem, as people feel compelled to keep eating long after they've satisfied their nutritional needs. Even though some argue that ultra-processed foods are not inherently harmful and that they provide affordable, convenient options, this perspective overlooks the broader, long-term impacts on health. Manufacturers often highlight the safety of their products based on FDA regulations, but these standards fail to address the cumulative and often hidden health costs associated with the consumption of these foods. As ultra-processed foods become more entrenched in the U.S. food system, they contribute to a variety of health disparities, particularly as they are often marketed to lower-income communities where cheaper, more accessible options are essential. The engineered nature of these foods, designed to hit the bliss point, the perfect combination of sugar, fat, and sodium, makes them exceptionally addictive. This tactic leads to a problematic feedback loop where individuals continue to seek out and consume more of these foods, undermining efforts to reduce intake. For example, foods like chips, cookies, and frozen meals often seem harmless, but are packed with the very ingredients that drive overeating. The research indicates that these foods are not only calorie-dense, but are also specifically designed to bypass the body's natural mechanisms for regulating hunger and fullness. The presence of these hyperpalatable foods in the food supply is not an accident, but rather a consequence of intentional food engineering. In fact, studies have found that these foods, which were once less prevalent, have steadily increased over the years, further displacing whole foods in the American diet. This shift has been accompanied by a significant rise in chronic diseases related to poor diet, particularly among children and low-income populations. The problem is compounded by the fact that ultra-processed foods are often marketed as convenient, affordable, and even healthy alternatives, even though the science consistently points to their negative health impacts. Addressing the omnipresence of ultra-processed foods requires not only personal awareness, but systemic changes. The food industry, driven by profit motives, continues to promote these products as desirable and even necessary components of a busy lifestyle. However, given their overwhelming contribution to rising healthcare costs and chronic disease, it's crucial to question the societal benefits of such products. While individual consumers can make efforts to reduce their intake by turning to whole, minimally processed foods, the broader solution lies in addressing the food system itself, including better regulations and public health campaigns that prioritize nutrition over convenience. The prevalence of ultra-processed foods in the American diet, combined with their addictive nature and severe health implications, signals a public health crisis that requires urgent attention. Despite their cheap, convenient, and sometimes appealing qualities, these foods contribute to an increasing burden of chronic disease and premature death. It is imperative that both individuals and policymakers take action to confront the growing dominance of ultra-processed foods, focusing not only on reducing personal consumption, but also on tackling the structural issues that allow such products to flourish in the first place.